Is there anyone from paper ID 299? One. Sir, kindly start sharing your presentation. Is there anyone from paper ID 40? Is there anyone from paper ID 40? Paper ID 73? Paper ID 73? Mr. Nitin Rakesh? Miss Sanvi Chauhan? Am I audible?
Yes, sir.
Ma'am, you are the first presenter, so please kindly start your presentation. And I'm telling you, you have only 15 minutes, 10 minutes for presentation, and 5 for Q&A. You let join. I already explain all the guidelines. So kindly start your presentation.
Excuse me, sir, I'm not able to share my screen. It is coming that only meeting organizers and presenters can share the screen.
Permission. Permission. Hello. Yes, sir.
Oh, am I
Okay,
audible?
okay, just wait. I'm enabling it. Yes.
Oh, awesome. You're sharing, right? Spotlight for everyone करना. हाँ, अपनी presentation कैसे मिलेगा? कहाँ presentation का?
I think अब कर सकते हैं.
क्या बोल रहे हैं इनसे?
Try again. रुको मुझे.
Ma'am, can you send the request again or sharing?
Yes, sir, sure. Sir, actually, my sharing option is disabled.
Wait, ma'am. Ma'am, I have given you the
Permission.
permission of presenting, so kindly start.
Okay, sir, sure. Is my screen visible to you, sir?
Yes, ma'am, it is visible.
So, good morning, one and all. My name is Shami Chauhan, and I'm from Chitkara University, Rajpura, Punjab. And today I'm here to present my research work on unmasking image authenticity, classifying the real and the fake human faces using convolutional neural networks, paper ID 299. So here we have the contents of my research
That
work,
looks still
followed
drops
by the
down.
introduction and the key contributions, input dataset, proposed
Yep.
methodology, results
And
and
my
findings, a conclusion, and at last references. First, we have the introduction and the key contributions. So, the rise of deep fake technology, which enables the creation of highly realistic but entirely synthetic human faces, has become a significant challenge in today's digital landscape. So, as the technology becomes more accessible, it has been misused for the malicious purposes such as spreading misinformation, impersonation, and identity theft. So the ability to detect the AI generated fake faces is therefore crucial to maintaining the trustworthiness of digital media. So this research aims to address this issue by proposing a convolutional neural network CNNs to classify the synthetic and the real human face images. So this study contributes to the growing body of work on deepfake detection by proposing an efficient and scalable method using CNN models for identifying the fake human face fake images. And the dataset for this research comprised a total of 10,000 images, which is further divided into training set of 7,000 images and a validation set of 3,000 images. So we haven't till yet it tested on the test set. So the CNN model was specifically trained to distinguish between the real and the synthetic images based on the nuanced features present in the deep fake content. So this model have achieved the 89% accuracy, and the successful application of CNNs in this domain supports the efforts to combat the spread of misinformation and ensures the integrity of digital content. So here we have the input dataset description. So the dataset used in the study has been extracted from open source platform Kaggle, consists of total 10,000 images, specifically designed to distinguish between the real and the AI generated fake human faces. And the dataset is evenly divided into two classes, real and the fake, with each class containing 5,000 images. And for training phase, we have taken the 7,000 images with 3,500 real and 3,500 fake images, which shows the balanced class, while the validation phase contains the 3,000 images split equally with the 1,500 real and 1,500 fake images. So the balanced nature of the dataset is crucial in reducing the bias and ensuring the model's ability to generalize well, uh, and therefore reducing the risk of overfitting. And the structure of the dataset plays a key role in assessing the model's effectiveness in accurately classifying the unseen data. So here we have the pictures from our input dataset. As we can see, the figure 1 shows the fake image class and figure 2 is the real image class. Here we have the proposed methodology of our research work. So the initial and the very first phase is the data collection. So the first phase of the proposed methodology is data collection, and in this study we have taken the 10,000 images from the open source platform Kaggle, and the images represents both the genuine human faces and AI generated deep fake faces. So this balanced data set is crucial for the training and evaluating the model. And the second phase we have is data preparation. So data preparation involves various pre-processing steps such as data augmentation, resizing of the pictures. So the collected data to make it suitable for the training. And the dataset is split into two subsets, 7,000 for training and 3,000 for validation. So several steps are taken during this phase, such as resizing, normalizing the pixel values, and introducing the new data augmentation to enhance the number of images and to make the model to generalize better. So third phase we have is model training. So at this stage, a convolutional neural network CNN is created for the image classification task. And the CNN model consists of various layers, including the convolutional layer, fully connected layer, pooling, batch normalization, and dropout layers. So these layers work together to learn hierarchical features from the input images and feature extraction. And during the training, the model uses the optimization algorithms like ADAM or SGD and applies the backpropagation to adjust the weights and to learn the distinguish between real and the fake images. And the last phase we have here is the model evaluation. After training the model, the next step is to evaluate its performance using the validation set. And the key evaluation metrics such as accuracy, precision, recall, and event score are calculated to measure how well the model classifies the real and the fake images. Here we have the results and the findings. So first we have the classification report analysis. So the classification report highlights the model's strong performance in accurately distinguishing between the two classes with an overall accuracy of 89%. And for class 0, the model achieved a precision of 87% and a recall of 0.91, resulting in F1 score of 0.89. In contrast with the class 1, which is the fake images, demonstrated slightly higher precision with an F1 score of 0.88 and a recall of 0.87. So the performance is well balanced across both the classes, and this indicates that the model performs consistently and effectively and offering a strong balance of accuracy and recall for both the classes. Next, we have the confusion matrix analysis. So the confusion matrix analysis reveals that the model effectively identified the 13612 true positives for class 0, which is the real image, and 1299 true positives for class 1. However, 201 instances of class 1 were misclassified as class 0, and 139 instances of class 0 were incorrectly labeled as class 1. So the precision of class 0 is 0.87, meaning the 87% of the predicted real images were accurate. And with an overall accuracy of 89%, the model demonstrates a strong and a balanced performance. Here we have the conclusion and the future scope. So in conclusion, this study demonstrates the effective use of CNN for detecting the deep fake images and achieving a strong accuracy of 89%. And the model shows a balanced performance across both the real and the fake classes. And the future work can explore refining the model by incorporating more diverse and more large data set, experimenting with the advanced deep learning architectures such as transfer learning, and applying techniques to enhance the performance of the model and to enhance the accuracy of the model. And additionally, the real-time deepfake detection system could be developed for the practical applications. So these are the references which we have used in our research work. Thank you. Now I'm open up for the questions, please.
Hello. Uh, Thank you for your presentation. I just have one question that is it only for the still pictures or you can use it for the moving images also?
Ma'am, right
Are
now
you
it
okay?
is for the still images only, and in future work we'll also develop. First, we have working on still images for the transfer learning models such as DenseNet, EfficientNet, or Exception. We will see the accuracy and we'll enhance the accuracy first, and we'll use this technique on the moving pictures or the videos also.
Okay. One more thing, you said that in CNN you have used to ADAM and SDG. Can you tell me what is the difference between these two? And where do we use them?
Sorry, ma'am, can you repeat? You are not audible to me.
What is the difference between the ADAM and SDG?
So the ma'am, Adam and SGD optimizers are commonly used in the training machine learning models, especially the neural networks, and each one of them has the unique characteristics suited for the different type of problems. Suppose, for example, if we talk about the SGD, stochastic gradient descent. So the most basic optimizer that updates the model parameters, and it is based on the gradient of the loss function with the respect to the parameters. And It is like simple and easy to implement, and it works well when fine
There is a
tuned.
one, sorry, there is a one specific difference between these two and where we use, can you just tell me that? Or if it is not, then it's perfectly fine. That's perfectly fine.
I think, ma'am, when the data is simple and doesn't require the complex adaptation, we use the SGD. And when you can't afford to tune the hyperparameters extensively, in that case also we use SGD.
Okay. Anyone else for the question? I think no one is interested in asking. Thank you so much, Shanvi, for your presentation.
Thank you so much, ma'am. Thank you so much for giving me the opportunity. Thank you. Should I leave, ma'am? Because I have one more presentation in some other
Paper ID
session.
40, kindly start your presentation.
स्टॉप प्रेजेंटेशन कर देंगे इनको बोल दो
Sir, good morning, sir. So share
Yes, sir.
option is enable for disable for me, sir.
नेम क्या होगा
Yes, sir. I give you the permission of presentation.
Yes, sir. Thank you, sir. Thank you.
Okay, okay.
PPT. Yes, sir. Open menu set பண்ணலாமா? Just a minute, sir. Good morning, sir.
Okay.
Is it
Yes,
visible,
sir,
sir?
sir.
My screen is visible?
Yes, sir. It is visible.
Yes, sir. Can I start,
Okay.
sir?
Yes, sir.
Yes. Good morning, sir. Good morning, everyone. My topic is enhancing predictive accuracy and interpretability through explainable deep ensembles learning for lung cancer classification. Myself, Dr. M.D. Anandraj, Assistant Professor in Computer Science, Loyola College. Co-author, Dr. S. Saini Carmel Mary, Assistant Professor in Business Analytics, Liba, Chennai. Introduction, AI in healthcare. The integration of artificial intelligence in healthcare has revolutionized disease diagnosis, treatment planning, and patent care. Machine learning and deep learning models have significantly improved predictive accuracy in detecting diseases such as cancer, cardiovascular disorders, and diabetes. Challenges in AI models. Despite their success, machine learning and deep learning models face key challenges. Number one is black box problem. Deep learning models lack interpretability, making it difficult for healthcare professionals to understand and trust their prediction. High dimensionality and imbalance. Medical data sets often contain large, complex, and imbalanced data, reducing model performance. Third one is overfitting issues. Traditional machine learning models may not generalize well to new patient data. So, need for explainable AI in lung cancer diagnosis. Lung cancer as a major healthcare concern, it remains one of the deadliest diseases worldwide. Early and accurate diagnosis is critical for improving survival rates. Why explainability matters? Physicians require AI model to provide interpretable insights for better decision making. Existing approaches, traditional machine learning models like random forest, XGBoost, and AdaBoost have improved prediction accuracy, but it is lack in transparency. Ensemble learning techniques help combine multiple models for better generalization and reliability. The proposed solution, XDEL framework. What is XDEL? Explainable Deep Ensemble Learning, that is XDEL, is a novel framework designed to enhance predictive accuracy and interpretability in lung cancer classification. Key features of XDEL combines multiple deep neural networks, DNNs, through ensemble learning. uses saliency maps to identify critical features influencing prediction. It improves accuracy while addressing black box testing in deep learning models. Research aim and contribution. Research objective is to design an AI framework that not only improves lung cancer classification accuracy, but also it provides explainability to aid clinical decision making. Key contribution: developing an ensemble model that combines deep learning techniques, saliency based explanations to highlight the most influential features, demonstrating superior performance compared to traditional machine learning model. So this is the explainable deep ensemble learning model. So raw patient data cleaning, feature selection, target identification. So all the model development, you can see the random forest, gradient boosting, ADA boost classification, and XGB classification. And the last one is XDEL, that is explainable deep ensemble learning. So we can see you can combine model 1, model 2, model 3. Then after salience map, we can get aggregate salience map. So this is the model proposed by this paper. The next one is result and discussion. Performance comparison of XL versus traditional model. The explainable ensemble learning XL model was evaluated against traditional machine learning models like random forest, XGBoost, and AdaBoost using key performance metrics. So accuracy, XDEL model, that is a proposed model, so 98%. Traditional model, so random forest, XGBoost, AdaBoost, so it is that it gives result 85 to 95%. Validation accuracy 1.0, that is 100%, and in other models 0.80 to 0.90. Loss near zero, and other model 0.1 to 0.3. Validation loss almost zero, and traditional model 0.2 to 0.4. Precision recall and F1 score, so 1.0, that is perfect score, and traditional model 0.85 to 0.90. Key insight from the results. So Excel's model achieves state-of-the-art accuracy. The model significantly outperforms traditional machine learning models in lung cancer classification. A reduction in overfitting. The validation accuracy remains high, showing better generalization than other ensemble model. Low validation loss. The almost zero validation loss indicates that XDEL makes highly reliable prediction with minimal errors. Saliency map insight for explainability. Why saliency map matters? Traditional machine learning model fail to explain their prediction. Saliency maps in XDEL highly highlight key features that influence decision making. Finding from saliency map analysis. Critical features are identified. Features 0, 20, 30, and 50 had the highest saliency values, meaning they are most important in lung cancer classification. Feature 21 shows the highest importance salience value, indicating strong influence in final decision. Unimportant features removed. Features in the range from 50 to 55 were found to be insignificant, helping in dimensionality reduction. Visualizing the explainability heat map. The saliency heat map highlights which features have strong versus weak influence in the model decision making. Bright yellow or white is equal to strong impact. Darker areas is equal to negligible influence. Discussion on practical implication. Number one, clinical relevance, improved decision support. Doctors can now rely on AI-driven explanation rather than just black box predictions. Enhanced trust in AI with clear features importance. Clinicians can validate AI recommendation before making medical decision. Overcoming key AI challenges. So, challenge lack of explainability, that is, the XDL model uses silence map to show feature importance. Overfitting in deep learning, ensemble technique prevent model from memorizing the data. High dimensional data uses feature selection to reduce unnecessary features. Feature scope, applying XDL to other medical data set could be extended to breast cancer, cardiovascular diseases, and diabetic predictions. Integration of SHAP for more explainability, combining shapely additive explanation with salience map for richer explanations. Transfer learning for limited data, testing the model on smaller data sets using pre-trained models. Thank you.
Uh, is this Mr. Anand Raj presenting?
Yes, ma'am.
Okay, I just wanted to know. So just one question, where from have you got the data set and what are the features you are taking as far as this cancer is concerned? Have you consulted any doctor regarding the collection of the data set and the features what you have to collect?
So we have used only the data set, ma'am. We didn't collect the real-time data set.
Achha, there is no real-time data set. So how
Yes.
have you verified that is it working or not if you are not tested in a real time?
Yes, real-time data set, if we are using it means definitely it will give more accuracy result. So we have tested with the a data set which is available with us for Google.
Okay, matlab like there is no proof that on a real-time data set it will give you a result what you are claiming.
Yes, ma'am.
Okay, anyone else who
Yes,
wants to
I
ask the
have a
question?
question.
Mhm.
Am I audible?
Yeah.
Yeah, I just wanted to know that what input parameters that you have taken.
Inputs, ma'am.
Yes, in your data set.
Okay.
And you should mention the limitations of your work, like challenges or something. I'm unable to find them that in your presentation.
Can you repeat the question, ma'am?
What were the input parameters? Have you run the
Parameters.
model? Am I audible to you?
Yes, ma'am. Yes, ma'am. Yes.
So in your presentation, I'm unable to figure these things.
Yes, I have
Like,
not included that the parameters in this
yeah, so you
presentation,
should
ma'am.
have done that.
Yes, yes,
And
yes, ma'am.
you have certain limitations also, like when you are applying AI to your health problems, like
Yes, ma'am.
2% we cannot leave because
Yes, ma'am.
that
Yes.
2% means a large, uh, uh, like somebody will
For
lose their
medical, yes,
life.
yes, 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 ma'am.
So on that basis, you should mention some limitations also.
Sure, ma'am. I
So that
accept,
was
ma'am.
not there.
Okay,
Yeah,
thank you.
rest
Sure,
is
ma'am.
okay. You need to work on it.
Sure, ma'am.
That is all from me.
Okay, ma'am. Thank you.
Okay, paper ID number 73. Who is going to present from 73? Am I audible? Who is going to present from 73?
I think she is not in the meeting. Monali.
Yeah, okay. So paper ID 283. Mr. Jatin Sharma.
Good morning, sir.
Okay, sir. Let me make you presenter. Wait.
Yes, sir.
Yeah, you could start now, sir.
Okay, sir. Good morning, sir. Sir, my name is Jatin Sharma. I am from Chitkara University, and my paper ID is 283. And my topic is Deep Learning Approach for Poultry Diseases Classification and Early Detection. So, this is my table of contents. Uh, and I start with the introduction and brief review. So my first in introduction, importance of poultry farming. Poultry farming significance contributes to global agriculture by providing protein high rich products like eggs and meat. However, the sector faces challenges from diseases such as Salmonella, Newcastle diseases, and coccidiosis, which can lead to high mortality rates and reduce productivity. Need for early diagnosis, accurate and timely classification of poultry diseases is critical for early intervention, enabling targeted treatments to prevent outbreaks, minimize losses, and ensure a steady supply of quality poultry products. Role of deep learning. Deep learning models, particularly ResNet 18, have proven effective for image-based classification tasks in agriculture and animal health. ResNet 18's residual learning framework address challenges like vanishing gradients, making it suitable for poultry disease classification. Objective of the study. This research leverages the ResNet 18 model to classify poultry disease into four categories: Salmonella, healthy, Newcastle diseases, and coccidiosis. The goal is to develop an automated and efficient diagnostic system that supports diseases control and enhance poultry industry productivity. So my problem statement is poultry farming plays a critical role in global agriculture, but the sector is plagued by various diseases such as Salmonella, Newcastle disease, and coccidiosis, which poses significant threat to food security and economic stability. These diseases is, if not diagnosed and treated promptly, can lead to high mortality rates, decreased productivity, and substantive financial loss. This study focuses on developing a robust classification using ResNet 18 to identify four categories of poultry health conditions. By enabling accurate and timely disease diagnosis, the proposed system aims to support disease management, safeguard poultry health, and enhance the productivity and sustainability of the poultry farming industry. So the objective of this is develop an automatic classification system, utilize the ResNet 18 model to accurately classify chicken health condition into four categories: enhance early disease diagnosis, enable early detection of poultry diseases to facilitate timely intervention, reducing mortality rates, and improving overall productivity in chicken farming. Ensure model efficiency. Evaluate the REST 18's models performance through metrics such as accuracy, precision, recall, F1 scores, and training validation loss trends to ensure its reliability and generalization to new data. Support sustainable poultry farming, contribute to food security and agriculture productivity by providing a trustworthy and automated disease diagnosis system, minimizing infections and improving poultry health and output. So the methodology and analysis. The proposal proposed poultry disease classification system employs the REST 9 net 18 model is four phases. Initially, a data set from Kaggle with 4 lakh of training and 40,000 validation and 70,000 test images across 4 categories was collected and pre-posed using resizing, normalization, and augmentation. The rest, the rest net 18 agriculture was fine tuned and modifying its fully connected layer from specific classification. The ResNet 18 model achieved 96% of accuracy, showcasing exceptional performance in poultry disease classification. Training and validation loss trends confirmed effective learning without overfitting. These results demonstrate the model's ability to generalize efficiently, making it a reliable tool for early poultry disease diagnosis and improve poultry health management. So the results and is classification report analysis performance across all classes. The ResNet 18 model achieved consistent and exceptional performance across the 4 classes. As evidenced in the classification report, the model overall accuracy across all classes was an impressive 96% reflective its reliability in poultry disease classification. Cocodai's classification for this category, the model demonstrated outstanding precision, recall, and F1 score, all measuring 0.97, showcasing its exception accuracy in detecting these specific disease performance of other classes. The healthy Newcastle disease and Salmonella classes are exhibited high precious recall and F1 scores ranging from 0.95 to 0.96, indicating robust performance across these diseases categories. Macro and weighted averages. The acro and weighted averages of precision, recall, and F1 score were consistently 0.96, further validating the model's balanced performance across the entire dataset of 70,677 images and highlighting its dependability for practical application. Confusion metric analysis, importance in multi-classification. The confusion matrix serves as a critical tool for evaluating model performance in multi-classification tasks like poultry diseases classification. It provides a detailed breakdown of true and predicted class frequency, highlighting the model strengths and weakness. Diagonal values, high values along the diagonal of the confusion matrix indicates the model's ability to accurately classify a significant number of samples within each classes, underscoring its reliability in distinguishing between disease categories. Off diagonal values. Misclassification are represented by off diagonal values which point to the area where the model struggles. Validity of model accuracy. The confusion matrix visually and quantitatively reinforce the model's overall validity and accuracy, making it an essential tool for assessing classification efficiency, and guiding further optimization. So the conclusion and future scope. The REST 1918 model demonstrate exception efficiency in classifying poultry diseases, achieving an overall accuracy of 96% with a strong precision recall and F1 scores across Salmonella, coccidiosis, Newcastle disease, and healthy state. The model proves to be a reliable tool for early disease diagnosis in poultry farming. The model ability to generalize well to new data support the by favorable training and validation loss trends confirms its robustness and efficiency in handling real world poultry disease classification. Future improvement could involve expanding the data set, integrating additional poultry disease, and exploring more complex deep learning architecture to enhance classification performance. Further model optimization and fine tuning would ensure ever high accuracy and real time applicability, thereby contributing to better disease management and improved poultry health and productivity global. These are the references used. Thank you. I am open for question and answers.
Uh, Thank you, Jatin, for your valuable paper on poultry disease classification. My question is same ki like have you tested it on the real data set? And if yes, where from have you got that data set?
Ma'am, I have got that from Kaggle.
No, no, or real. Have you visited some poultry farm and uh, got some input that what are the diseases they are facing and what parameters you can say that this particular this disease is there in any of the poultry this thing. So you have to basically do it on the real time data. Kaggle is the thing data which is there which they have already collected from different sources, but that is for you to use to train your model, and then you have to seek that whether it can be used on the real time data.
Yes, ma'am. Ma'am, I will. I haven't visited it yet, but I will visit it soon.
See, then the only problem is that what is your contribution then? If you have not checked it on the real time data, that what accuracy you are getting for detecting the disease and all those things, and what are the parameters on which you are basically classifying the disease and everything, so then it doesn't make any sense.
Mm, Ma'am, I have fine-tuned Net 18 model, comprising 18 layers consisting of conv- convolution batch and
Did I
normalizing.
understand what all you have done, but till the time you don't verify it with the real time data, you cannot say that what is the accuracy you are getting.
Ma'am, I will verify it
ठीक है.
in future. Yeah, ma'am.
Any other question from any other person?
No, ma'am.
Okay, chalo, we can proceed with the next one.
Thank you.
Paper ID 73, Miss Monali.
Yes, sir. I'm there.
Okay, ma'am,
Am I
let me make
audible
you presenter.
clearly?
Yes, ma'am, you are audible.
Am I okay?
Ma'am, I have make you presenter and please sum up your presentation in 10 minutes
Sure.
so other can get chances. Okay, start.
Yes. Uh, Give me a minute. I'm sharing my screen. Let me know if it is visible. Is my screen visible?
No, ma'am. Yeah.
Now
It is visible now. You can start, ma'am. It is visible.
it is visible, right?
Yes, ma'am.
Okay. So this is paper ID 73.
Ma'am, actually, it is not visible
What
now.
happened? Now it is not visible. Okay. There is some fluctuation in the network, so I'll stop sharing and I'll reshare it again.
Okay.
I
Now,
hope now it is visible.
now, yeah. It is the start.
And in the middle of the presentation, if my presentation stops or any kind of glitch comes, please do let me know, sir. I'll stop the screen sharing and I'll reshare it again.
Okay, ma'am. Sure, ma'am.
So this is paper ID 73, and I am presenting paper on cross-parametric analysis and neural network. I, in this conference, that is International Conference of Pervasive Computational Technologies. I am Monali Gullane, presenter of the paper. So let me first introduce you to the normal human detection techniques that we have for the early detection of different types of diseases. So whenever a disease is present in the body, we generally think that there are some discomforts or what we can say we have some parametric disorders in the behavior of the body functions. For example, if the glucose level is high, we feel sometimes we are dizzy, or we have another kind of high glucose level diseases inside the body. We also prone to cardiac arrest if the glucose level is high. So ultimately, I propose that there is cross parametric analysis involved in analyzing multiple parameters simultaneously. So what are we going to do is the theory part of this paper, mainly diagnosis for the improved method in which we can have an detection of early analysis of diseases. But we can also predict that if there is one disease in the body, there can be multiple disease which can be interrelated to each other. So that is why we name it as cross parametric analysis. And here comes the neural network into the scene. So basically, there are many traditional methods available on the internet, as I have mentioned in the introduction slide also. That traditional diagnostic method often rely on a single parameter and single analysis. So there can be a chance of false positive values, which can lead to the misconception or misdiagnosis from the doctor's side or from the medical instructor side. So that's the second part of my slide says that cross parametric analysis involves analyzing multiple parameters simultaneously and offering comprehensive understanding for patient's condition. Now this approach is combined with the power of neural network, which has a potential for revolutionize the medical diagnostic, which is leading to improved accuracy. Ultimately, I'll propose that in my results, which will be showing an better patient outcomes. Okay. And which will help us to have a future for health related diseases. So the problem that we have identified is that the gap between highly accurate and efficient diagnostic methods, which are in traditional methods, are not that much capable. So we can say that by leveraging the power of parametric analysis and artificial intelligence, including machine learning different models, we can bridge this gap and improve the accuracy for the precision of diagnosis based on not only one parameter but multiple parameters. So that is how the problem statement evolves behind this research. So I would like to explain what is cross parametric analysis. We have 4 to 5 conditions concluded in our paper also. If you say, I'll show my paper where these conditions I have included. Now whether we can conclude that a patient is having heart disease, patient is having only heart disease, patient is having only diabetes, or the patient is having only cancer. So if we concentrate on these three disease, for example, in taking a case study for cross parametric analysis over here, it can be seen that one disease accompanied with multiple disease. Therefore, I have mentioned in this slide that in medical diagnostic, cross parametrics allows a doctor to consider a wide range of factors such as age, genetic, lifestyle, and environmental exposure, leading to more accurate and personalized diagnosis. This can also help to identify patterns and correlation that might be missed by the traditional or single parametric analysis. So the benefit of cross parametric analysis extend beyond the improved accuracy. Means it is not only we are saying that it will be an improved accurate method, but it will also help to minimize the risk of missing any kind of diagnosis. Means one disease can be overlapped with other diseases also. So the neural network that we are trying, this is only a simple neural network, because at this level of the proposed model, we haven't gone to deep learning or transfer learning or machine learning. We have simply included NN, that is neural network, studied to check whether it is working correctly on other cross parametric analysis or not. In further, in the next extended part of this neural network, deep learning is a specialized neural network which can be used for medical imaging. If we are using greater large amount of data and analytical part of data, it has an ability to learn the large data set also. So we propose that the neural network can be more intelligent to predict the cross parametric analysis. So hello, am I audible? Hello.
Yes, ma'am. Yes,
Yes.
ma'am, you are.
Okay, sorry. I thought there is a fluctuation in the network. Okay. So the methodology that we have implemented consists of four major parts. As you can see, the first part says that the method involves a series of steps where we have tried to analyze the data, train it on the simple neural network, and validate the performance. The second part explains the pre-processing that we have performed on the data. Example, I would like to mention that we have performed pre-processing on missing values. We have done pre-processing on optimizing the contents if the values are not accurate, and resize the data into the data frames. And we have done a feature extraction method, which is simply done by simple neural network. We haven't include much complexity because this kind of study require some observations also we have mentioned in the paper, which sees that the relationship between the pattern of the diseases can be based on the parameters. The final step, we have concluded that neural network is efficient for concluding for multiple parameter and multiple diseases also. These are some of the experimental result. I would like to take some time and explain these results in more detail part, that the key factor for the diabetes, suppose we have an hypothesis to be done in the paper, which is based on the cross dependency analysis. It is observed that BMI is related to the 60% of the cases between the heart disease and the diabetes disease. Means if a feature of BMI I have taken from the data set, I can say that from those feature, 60% of the people is having diabetes as well as heart disease. So this is the first conclusion. Thus, if the clinical parameters are coming into scene for the diabetes, again, I can more accurately say that diabetes can be ultimately included to the glucose level. So if this 40%, 45% of a people having diabetes can also have heart disease. So that is how I have tried to interrelate the cross parametric dependency. Feature number one, feature number two, and feature number three. Ultimately, it is, I would like to explain you that feature number one in heart and diabetes is BMI. Feature number two is insulins or insulin level, which says that 45% people having heart disease can also have diabetes. And glucose is the third parameter. Now, when we are comparing diabetes to cancer, we
Ma'am,
can say that
sorry
there
to
is,
interrupt you.
yes,
Ma'am, actually, we have less time, so you have only 2 minutes.
should I sum up?
Some
Yes, ma'am. You can
Yes.
sum up.
Okay. Yes. So I would like to explain the last part over here very carefully. That diabetes to cancer, if a person is having a gradual loss in the weight, we can say that diabetes and cancer are related in 20% of people, accompanied with the obesity and the genetic histories. So as in this sum upping of this presentation, I conclude that the impact of medical diagnostics is very substantial, and lot of machine learning techniques are already ongoing. But cross parametric analysis can be more into research for the hypothesis of dealing with the early predictions of disease. Thus, I conclude that including deep learning and higher machine learning models, we can develop a more predictive proposed model for analyzing the parameters in cross. So that is how I conclude, and these are some of the references I have put. I am open to questions if any.
இல்லடா
Hello.
அதுதான் பேச முடிச்சேன் ஒரு 2 வேலையா இருந்துச்சு பேசல லீவ் உனக்கு
Thank you, ma'am, for your presentation. Just
Yes,
one
ma'am.
question from my side.
Sure,
Are
ma'am.
you
Please.
focusing on specific disease or it is a general disease you are saying?
Ma'am,
See,
for
cross
now,
platform is cross parametric is always there for any type of a disease. If you look for any
correct.
disease, you have to look in for different parameters. So that's
Correct.
what. But finally, we are focusing on the one disease. So have you done your research on some specific disease or it is a general
Uh,
what you are talking
I
about?
would, for explaining, I'll just sum up my answer in 2 minutes. I'll just take you through through the part that you are asking me in through my paper, is that means there is an hypothesis that we have trying to analyze, and a lot of clinical tests has also been done further for this conference paper taking to journal. As we are saying about the cross parametric analysis, we have considered 3 diseases for this study purpose for now. The 3 main chronic disease, as per the WHO, says that heart, diabetes, and cancer are the most predictive chronic disease. So for now, we have taken 3. But yes, if the advanced machine learning models and deep learning are involved, we are trying that it can be somehow predicting larger scales of other diseases also. So basically, I'll go with chronic disease if you ask for communicable. Sorry, non-communicable chronic disease. Yes.
Okay, you haven't done any testing as of now on real-time data.
As of now, no. This is, I would like to share you, I would like to show you also this. So this is a predefined data for diabetes PIMA data, that is more popular data. There is, so we have include that. For heart disease UCI, this is freely available data. So lively in the result analysis also, we have taken an available sourced data that are freely given for the research purpose. Right now, there is no live data on it.
No primary data, no?
No. There is no live data because since we not need to test that how the cross parametric analysis will go in simple neural network. So this is only a testing part.
Okay.
Right.
Thank you so much.
Thank you so much, ma'am. If there is any kind of suggestions you would like to suggest me in the paper, I am open to it. Otherwise, okay. Should I stop the presentation?
Yes, ma'am, you can.
Okay.
Okay. Paper ID number 379. Anyone from 379?
Yes, me.
Okay, let me make you presenter.
Okay. I still cannot share my screen. Oh yeah. Okay. Thank you.
Okay. Ma'am, you also have 10 minutes, so please, can you sum
Oh
up
yeah.
quickly?
Okay. I tried to present
Okay, ma'am.
quickly. Windows. Can you see my screen?
Yes, ma'am. Yes, ma'am, I can see.
Okay. Thank you. Good morning. Uh, my name is Dian Kurnianingrum, and I am from Bina Nusantara University in Indonesia. And today I will be represent my colleges to represent our paper, which have title from traditional banking to fintech, analyzing the evolution of online loan research. Online loan are becoming more popular, changing how people and business get credit. This growth has caught the attention of researchers and policymakers because it offers both benefit and challenges. And this research will map out what we know about online loans, highlighting the most important contribution and setting the stage for future studies. By reviewing published articles, we can understand how online lending has developed and its impact, helping both practitioner and scholar in this growing field. This research study has four research questions. The first research question asks about the publication and citation structure of article on online loans. The second research question inquires about past research topic related to online loans. The third research question focuses on author co-citation analysis of previous studies on online loans. And finally, the last research question examines the co-occurrence analysis of keyword in publication related to online loans. The first step taken by the researcher to meet the research objectives was data collection and publication data on the topic of online loans were retrieved from the Scopus database on July 22, 2024, and the criteria used were online loans. The limitation applied were studies in the field of business management and accounting and studies in econometrics, and finance. Another limitation was that the research had to be in English, and the collected data set was then analyzed using literature review and bibliometric analysis approach. Uh, Past publication topics were analyzed with the help of LDA, and data from the abstract of previous study were processed so that the researcher could map the main discussion topic of past research in the bibliometric analysis stage, and the data set was processed using FOSS-Viewer software. And based on the Scopus dataset, there are a total of 432 papers related to online loans with 9,688 citations in total. The highest number of papers was published in 2021 with 65 papers. However, the most influential paper measured by total citation per total paper or TC per TP was written in 2006. And this is the paper which is list based on citation. And this is our LDA analysis result. From the LDA analysis result is shown in this table that cluster 1 appear to focus on traditional banking institution and their involvement with credit and financial market. It discussed study related to banks, the risk associated with banking and credit, and the overall financial market. The presence of work like data and study suggests that this cluster includes research paper and studies analyzing various aspects of banking and financial risk. Meanwhile, cluster 2 focus on peer-to-peer lending and the dynamic between borrower and lender. And cluster 3 centers on the intersection of finance, business, and fintech innovation. It discussed financial model, credit system, and the impact of fintech on traditional banking. The result of author co-citation analysis sorted by the number of citation. The co-citation analysis of author in the online loan research topic highlight the most influential researchers and their interconnected. Lin M. and Viswanathan S. emerged as the most cited author, particularly within the red cluster, indicating their central roles in the field. The co-occurrence analysis in the study used a minimum threshold of 5 occurrence. The keyword co-occurrence for the dataset on online loans is divided into 6 clusters: red, green, dark blue, yellow, purple, and light blue. And red cluster consists of 18 keywords. The green cluster has 14 keywords. Dark blue cluster contains 13 keywords, and the yellow cluster includes 10 keywords. And the purple has 9 keywords, and the light blue has less than 3 keywords. That's all my presentation. Feel free if you have any question.
Thank you, ma'am, for your presentation. It was really nice to hear your presentation. Any question from the from anyone? I think there is no question from anyone.
Okay, thank you.
Okay. Paper number 551. Is anyone from paper number 551? Paper number 551. Anyone from paper number 551? I don't think anyone is there from paper number 551.
Ma'am, one request from paper 771 actually. So we are from US actually. So we are from United States. It's already like 12:20 for us. So is there any possibility to present it right away?
What is the paper ID?
771.
So you are not in this track. When is your track? You are in the next track.
Yeah, I think we are scheduled for 3 o'clock in today. Shreya sir, could you please add here?
Yes, ma'am. It is a D1 BD. This is our session name. D1 BD is our session name.
Just a minute, sir.
Yes, ma'am.
Sir, can you please tell me the exact time and date when your this thing is scheduled?
Date is today, ma'am, and timing is 2 to 2:15.
2 to 2:15 today.
Session name is D1 BD.
Session is
D1.
D1. I will have to check out because just give me a second.
You said feedback.
Sir, I'm really sorry. I think you're scheduled in some other track, so I'm not able to find your paper number in my track. So I can't
Madam, ma'am,
accommodate.
it is 701. It is
701.
701 paper ID. Our session name is a D1BD. Our theme is
D1,
AI and emerging D1 hyphen
D1
BD.
hyphen
D,
BD.
D, BD. Yes, yes. This is our
Yeah,
session name, and our theme is AI and emerging technologies.
AI in emerging technologies.
Technology.
Uh,
Yes, ma'am. Paper ID is 701.
Sir, I'm really sorry. It's not in my track. It's in some other track, so I'm not able to find your paper in my
Would you
schedule.
allow us to present our paper, ma'am? Because
I think because the recording is going on, so we have to make sure that it goes in the proper track. I'm really sorry.
after everyone's presentation, we can present.
Sir, that's not an issue.
After
We can give the extra time. The only thing is that it's not in my schedule, so I cannot find your paper here. It's in some other track, and some other session chair is there, so they will mark you absent there. I'm really sorry, sir.
There's a separate link given for that schedule.
Yeah, there must be some separate link. You can join
yes.
on that link.
Okay, okay.
Okay, is this paper ID 551 there? 551 is. I think paper number 551 presenters are not there. So Dr. Archana Sar, on behalf of JL Bajaj, I really thank everyone who is present. The presenters, so who basically presented a very important topics on the latest technologies. The only thing is that what I was expecting that there should have been a real time validation of what they have done in their papers, but nevertheless there is always an improvement and there are always limitations. And big thank goes to our session chairs, Dr. Deepak Kumar Verma and Dr. Nita Kumari, who basically took time from their busy schedule, and basically they are the session chairs for this session. I really thank them for giving their time. Thank you so much, and it was wonderful listening to all the presenters. Thank you.
Thank you, ma'am.
Now all of you can leave the session.
Yeah.